thank you for the invitation and thank you for the hospitality to date. So I feel like a bit of an imposter, I think, on two counts. First of all, I'm an endocrinologist at a cardiology symposium, which is always an interesting place to be. And the other is that I'm going to be teaching you something or telling you something about lifestyle and self-management. And I come from Scotland, which doesn't always have the best reputation in terms of lifestyle management for diseases like diabetes. For those whose geography may not be so good, Scotland is, of course, this northern bit of the UK, and just to say we are the bit of the UK that unanimously voted to stay in the European Union, unlike other areas. But hopefully what I can do is share with you some of the experience we've had in Scotland in terms of being able to integrate data across the entire nation and what that's allowed us to then do in terms of promoting self-management and improving our healthcare reporting systems. So diabetes lends itself very well to technology online-based support in a number of different ways, and I'll just go through some of these briefly and then I'll focus more on our own initiative. So electronic patient held records you've heard a little bit about, and I'm going to talk to you a little bit about what we're doing in that space. Virtual clinics we're starting to do more of, and certainly Skype-style clinics we use a lot in our remote locations up in the north of Scotland, and there's now good evidence supporting this, some of that work coming from Newham down in London area. E-learning, there's a lot of e-learning out there for diabetes, some of which has a very good evidence base, others less so. Obviously diabetes, as with cardiological diseases, we're interested in getting people to exercise and improve their lifestyle, and starting to use more and think about how we integrate our data from wearables. The diabetes online social media community is absolutely massive, so there's a huge online presence for diabetes, and our patients certainly seem to find that very useful for sharing information and getting peer support. Apps, you've heard a lot about health apps. In the diabetes world, there are over 1,500 apps just for diabetes management, and how we encourage our patients to use these or not, how these are regulated, is a difficult area, which again we've covered some of today. One of the biggest changes, I'd say, in recent years with diabetes management has been around remote monitoring and feedback. And in diabetes, we're interested in blood glucose, but also other parameters. And a lot of the technology, which I'll talk a little bit more about in the next slide, has allowed us to do this in a much more efficient, flexible way. And this is becoming very much part of our routine practice now. And the other area with diabetes is the whole area of automated insulin delivery systems. And this is more thinking about type 1 diabetes or type 2s on insulin, where there are now a number of systems, either web-based, app-based, or built into blood glucose monitors that have automated algorithms that will dictate the insulin dose that a patient requires, which is based on that constant feedback, either from a continuous glucose monitor or from finger prick testing. So we're moving into the world of real-time automated treatment for diabetes. As I mentioned, this is one of the areas which is probably transforming our practice as more than others, and it's around home blood glucose upload. So as a diabetologist, I really rely on looking at blood glucose readings for patients. Now, if you're lucky, about a third of the patients who come to clinic would bring with them a diary with their blood glucose readings in them. The other 2/3 usually brought nothing, and you're really in a dark space in terms of trying to advise around glucose doses. Nowadays, what we're encouraging patients to do is either upload their meter at home, or when they come to clinic, the data's there, it's transparent, there's no arguing about it, and you can have a much more meaningful conversation with the patient and have a shared decision-making experience where you can start to really impact on glucose. So I'm going to talk now more about our main initiative, which is something called Diabetes My Wii. This is the NHS Scotland's national diabetes online platform. I work with the University of Dundee, and this was created by the University of Dundee, but the Scottish Government pay us to run this on a national basis. So Diabetes My Wii started off life as just an education website. We went around Scotland and we collated the best education resources that we could find, and these were videos, games, animations, text-based leaflets, but we digitized all that content and we put it online. So this is just an example of a leaflet telling somebody how to look after their feet when they go on holiday if they have neuropathy. This is an animation through the diabetic retina that takes patients through that. This is a game where you can drag and drop your food into a basket and it tells you the nutritional content of that. So that was fine. That was a nice educational website. It got lots of hits. But what we know is that patients prefer information that is tailored and personalised to them. And because we're very data rich in Scotland, what we've now been able to do is start to personalise our education and the information we deliver to patients based on their data. So this just shows our diabetes data integration in Scotland. As I say, we have a unified diabetes registry that spans the whole of Scotland. So all 285,000 patients with diabetes in Scotland are all within our Sky Diabetes platform, which is the main clinical platform that I will use when I'm in clinic, whether I'm based in Dundee, Edinburgh, Glasgow, or up in the north of Scotland. And it's accessible to primary care, secondary care, anyone who's managing somebody with diabetes. It pulls data in from all the GP systems, so every primary care practice in Scotland contributes data to this, and it comes in on a nightly basis. All the laboratories in Scotland, all the secondary care systems in Scotland, our national retinal screening programme, and inpatient data as well. And that data is used for a number of purposes. It's used every day when we're managing patients, but it also goes to contribute to audits, reports. We have an annual Scottish Diabetes report that reports on all this data. It's critical for diabetes research, and in terms of running clinical trials, we can immediately access patients that we need for specific clinical trials. And we push that data into My Diabetes My Wii, which I'll show you more about. So all of our patients now have access to all the data that we as clinicians have for their diabetes management. So My Diabetes My Wii has moved from just being an open access education website to a very data-rich site for patients. So we integrate healthcare institutional data, but we also pull in data that patients are recording. So that might be their blood glucose data at home, it might be blood pressure data they're recording, data on their weight. And we're also now developing the APIs to start to pull in data from things like Fitbit, MyFitnessPal, and some of the other remote activity monitoring systems. So what do you get when you access the portal? So this is all test. This is a dummy patient data that I'm showing you. But this is a patient who's going in and looking at their biochemical results. So what you can see here is that they can look at all their blood results, HbA1c, blood pressure, cholesterol, and so on. We also have tailored links on the right-hand side here. So every page that the patient goes to, there will be education links. And those links are tailored to that patient. So dependent on their type of diabetes, the type of medication they're on, their foot risk score, their retinopathy status, and so on, we will then tailor that education very specifically for that patient. So for example, if somebody has a certain stage of diabetic retinopathy, we will link them back to an animation video, to the bit of that video that is specific for them. If they have high-risk feet for neuropathy, we will link them directly to the foot care leaflet that is relevant for high-risk feet, and so on. So this is just an example. They can drill down, they can look at their data, they can look at graphs over time, they can see whether they're in the green range or not. They can do that for all their results. And we also have little question marks with all the data. So if they don't know what HbA1c is, or BMI is, or blood pressure is, it gives them more information about that and explains it in a very patient-friendly way. This is an example of some of the reports that we produce. So in the UK, we have Diabetes UK as our main diabetes charity, and they've stipulated 15 care measures, which are the key things that every patient with diabetes should have done over the course of the year. So again, we link the data back, so we give them their personalised Diabetes UK 15 care measure report, which is real time, it's updated every day. And they can look through that to see whether they've had their eyes screened on time, their cholesterol's been measured at the appropriate interval, their HbA1c's been done. And if it's not, then they can print that off, they can take it to their healthcare professional, and they can make sure that they follow up any results that need to be checked. We pull all the prescribing data from the GP practice so they can look at their full medication record. If they don't understand why they're on any of these medications, we link through to more information about them so they understand the medication, they know what the side effects might be, and hopefully this empowers them and motivates them to actually take the medication because they understand why they're on it. We comment on their trends in their data, so if the data is moving in a certain direction, again, we comment on that. We give them very personalised feedback on their data trends, and that links into more educational information if they're not meeting the targets. They can set goals, so here's some example of goal setting around smoking status, weight, blood pressure, and so on, and we encourage them to set goals, amend those goals, and give feedback on how they're doing in terms of achieving the goals. And as I said, we link in with a lot of remote monitoring data. So Diasend is a Scandinavian product, a third-party product, which integrates blood glucose data into a standardized format from multiple different blood glucose monitoring devices. So we pull in that standardized data. Patients can view their home blood glucose data through the system. And we're also starting to use that raw data ourselves to generate personalised reports. So this is an example of a report which could go out to a patient on maybe a 2-weekly or a monthly basis, giving them very detailed feedback on their blood glucose measurements and how they can improve those. And we're starting to now look at systems to push that back so we can deliver, for example, SMS messages to patients. So when they upload their monitor, they get automated feedback that might say, okay, you've been having a lot of low sugars recently, maybe you want to speak to your healthcare professional about this, maybe you want to reduce your insulin dose, and so on. These are just some examples of the type of messages that we can start to send out through very automated feedback of using the data. We've incorporated Moodle, which is an open source e-learning platform, so that we can put e-learning on the site so that patients can work through structured e-learning programs. This is one for young people with type 1 diabetes. And we're incorporating communication tools so that patients can go into the platform, they can securely communicate with their healthcare team. They can also go into discussion groups with other people with similar types of diabetes, so gestational diabetes, type 1 diabetes, type 2 diabetes, and get peer support through the site as well. So we've gone from really an education resource site and an electronic patient health record access site to a site that's sort of linked much more widely and incorporates communication tools, personalised advice, algorithms, and patient reports. And we're keen to develop this further in the way of sort of predictive analytics using this sort of rich data set that we've got so that we can start to intervene early to try to prevent disease complications occurring. At the moment, it's available to all patients in Scotland with diabetes. We have about 21,000 current registrants. It's very cheap to run. We run this obviously as a university, so a not-for-profit basis, and it costs about 43 pence per diabetes patient per year to run this across Scotland, which, considering the cost spent on drugs, is pretty small. And our main website gets about 115,000 hits per month. We've won lots of awards, which I won't go through in detail, but it's won a lot of national quality awards. And we've done some evaluation ranging from user surveys. So this is over 1,000 users reporting that about 90% of them felt it helped them make better use of their consultation, helped them manage their diabetes better, improved their knowledge and motivation. This is just some feedback from the website and social media, which I won't go through in detail, but you can read that. We get very good feedback from patients. And as cardiologists, you'll be interested in the hard numbers. So here's some hard numbers that we're starting to generate. This is users before and 1 year after using our platform, showing improvements in all the markers you'd expect: HbA1c, BMI, cholesterol, systolic, diastolic, blood pressure, and weight. And we're starting to do some case control analysis, and I've got some funding for cost effectiveness analysis and hopefully a randomised control trial as well, just to improve our evidence base. We're now looking at expanding this beyond Scotland. We've got about 8 trusts in NHS England who are interested, and we're trying to say, well, can we take this platform and put it in a different environment? All we need is the right data feeds to do that, and the platform can function. And we've also got interest out with that in Europe, Middle East, and India, where we've got some grant proposals in process. But there's also opportunities to expand this platform out with diabetes. It would very well fit with other long-term conditions, including renal, respiratory, cardiac disease, and so on. Obviously, the data feeds may be slightly different, but the broad principles and some of the generic aspects of the platform would still very much stand. So very interested in discussing that more if that's of interest. Thank you very much.